In this video, we are going to learn about Bell's palsy or facial paralysis. Bell's palsy, also termed as idiopathic facial paralysis, is one of the most common neurological disorders of the cranial nerves. Bell's palsy is a form of temporary facial paralysis resulting from damage or trauma happening to the seventh cranial nerve, that is, facial nerve. History of the disease. The disease is named after a Scottish surgeon, Charles Bell, who first described the connection of the facial nerve to this condition. The anatomy of the facial nerve. The facial nerve, also called the seventh cranial nerve, travels through a narrow bony canal called the fallopian canal in the skull beneath the ear to the muscles on each side of the face. For most of its journey, the nerve is encased in this bony shell. Epidemiology of the disease. Bell's palsy is the most common cause of one-sided facial nerve paralysis. It occurs in 1 to 4 per 10,000 people every year. It most commonly occurring in people between age 15 and 60 years. Males and females are affected equally here. The etiology of the Bell's palsy. Bell's palsy occurs when the nerve that controls the facial muscle is swollen, inflamed or compressed, resulting in facial weakness or paralysis. Exactly what causes this damage is not known, and sometimes it's often linked to the exposure to a viral infection, and sometimes it is believed that it is happening because of herpes simplex or varicella zoster infection. The pathophysiology of Bell's palsy. The facial nerve swells and becomes inflamed, causing pressure within the fallopian canal and leading to ischemia, which means the restriction of blood and oxygen to the nerve cells, which may cause an interruption in the message the brain sends to the facial muscles. This interruption results in facial weakness or paralysis. The signs and symptoms. Rapid onset of mild weakness to the total paralysis on one side of the face occurring within hours to days. Facial drop and difficulty in making facial expression such as closing the eyes or smiling. Headache is another symptom. Drooling of saliva. Pain around the jaw or behind the ear on the affected side, increased sensitivity to sound on the affected side, a decreases in the ability to taste, changes in the amount of tears and saliva, other symptoms such as discomfort around the jaw, behind the ear, ringing in both the ears and headache, etc. So here is a picture which shows you a person with a Bell's palsy trying to open his mouth, closing his eyes and showing the teeth. Treatment. In most of the cases, Bell's palsy symptoms improve without any treatment. However, it can take several weeks or months for the muscles in the face to regain their normal strength. Corticosteroids such as prednisone may improve the recovery at 6 months and others recommended. Early treatment within 3 days after the onset is very necessary for the early benefit. Antivirals such as acyclovir is very effective in improving recovery from Bell's palsy. They are commonly prescribed due to the theoretical link between Bell's palsy and the herpes simplex and varicella zoster virus. Physiotherapy can be beneficial to some individuals with Bell's palsy as it helps to maintain the muscle tone of the affected facial muscles and stimulate the facial nerve. Surgery may be able to improve the outcomes in facial nerve palsy. Smile surgery or smile reconstruction is a surgical procedure that may restore the smile for people with a facial nerve paralysis. Eye protection. The eye on the affected side cannot close naturally, hence the front of the eye is risk for damage. The patient should be given artificial teardrops to be used during the day and a lubricant ointment for using at night. Patient can also be advised to wear glasses to protect the eye from dirt and dust during the day and use an eye patch to keep the eye closed at night. And regarding the prognosis of the disease, in the majority of the cases, Bell's palsy gradually resolves over time if no secondary etiology exists. Bell's palsy has a high rate of spontaneous recovery and people often recover fully without any treatment, so you can reassure the patient. Thanks for watching. Please subscribe to the channel for getting more informative videos. Thank you.